Well, good morning or good afternoon to everyone who's joining the webinar, I guess depending on where you're located. We are excited to have you here today. I am Chad Schiffman. I am the Director of Compliance here at Healthcare Compliance Pros. And today on the line, we have Loretta Maddox. She's our Compliance Specialist, as well as Nicole Mark. She's our Marketing Manager as well. And so all three of us are on this call today. Nicole will be fielding any questions that come in as part of this webinar. And today we're going to do it a little bit different. So both Loretta and I have been extremely involved with Section 1557 throughout since it was signed into law. Well, Loretta has become quite the expert with Section 1557 of the Patient Protection and Affordable Care Act. So today we're going to revisit some of those things that first were signed into law back in 2016 with some of the laws that came out regarding notice of non-discriminations and things of that nature. And then we're going to talk about some enforcement activities that have happened, as well as some recent changes that have happened to Section 1557. So recently, even this year, we have seen several resolution agreements come down the pipeline from OCR. A lot of these resolution agreements are pertaining to Section 1557. And what I'd like to do today is turn the time over to Loretta to talk about some of these resolution agreements, some of the things that we're seeing with it. Loretta, what have you found with some of these resolution agreements?
Well, and thank you, Chad, and thanks to all of you that are attending today. We have noticed with the OCR, and especially during the COVID pandemic, the highlight of individuals that are in protected classes, individuals with disabilities, individuals with limited English proficiency. And so what we've seen from the OCR, actually when we were developing this presentation, there had been 4 case resolutions issued since April of this year. And they all involved states that were 3 of which involved states' triage policies as it related to treating patients for COVID. And so I think what had happened is a lot of these states had old triage policies that maybe had not been either visited or revisited because we had never been in a global pandemic before. And so once these triage plans were put into place by states like Tennessee and Pennsylvania and Alabama, groups started recognizing that there was some discrimination within those plans. And so the OCR did receive those complaints, and they have issued pretty quick resolution agreements with each of those states. Now, the latest release, well, the latest before this morning, I believe, Chad, is when we got our latest one. But on June 9th, there was actually an issue with Connecticut and not allowing people with disabilities to have reasonable access to support individuals. And so that was the latest issue before we received another issue this morning from Puerto Rico, which we're going to talk about in just a little bit.
Yeah, and each agreement seems to have some similarities and some differences, as we've noticed. And, you know, as you have just talked about, their OCR is essentially putting a lot of focus on Section 1557 again. And in fact, this recent bulletin that came out on May 15th. Now, you've read into this a little bit. Can you tell us a little bit about this bulletin?
Sure, and I think what prompted this, as the OCR in many cases, sometimes a little later than we would like, but they will issue guidance and kind of remind covered entities what their responsibilities are. And so from the issues that they had in April with states' triage policies, I believe that drove this bulletin, which is basically some guidance and a reminder that, hey, everybody, we've got to be making sure that even during the crisis like we're experiencing with COVID, we still have to make sure that the rights of people with limited English proficiency are still being adequately taken care of. And so that's what issued this bulletin back in May. But then even still, there are complaints being issued at a higher extent now, I think, because of our current crisis. So Just to kind of remind everyone what Section 1557 is, I know I still interact with organizations that when I say Section 1557, they're like, what does that mean? And so we thought it would be a good idea to just do a little bit of a refresher on what it is. And so basically, this is the non-discrimination provision of the Affordable Care Act. And initially, it did add some additional requirements that were above and beyond the long-standing non-discrimination statutes that have been in effect for many, many years. And so initially, most of these regulations went into effect in July of 2016. And then we had, if many of you that are on the call remember, in October of 2016, it almost kind of blindsided a lot of healthcare providers that, oh my gosh, we have this requirement now to put all these posters in our office, and we didn't really understand what our requirements were regarding that. And so that was a big change for many of us in healthcare. And so what has happened since that time is a final rule has been issued that actually made some changes, and it was just issued this month, and it does have an effective date in August, but it does have some significant changes in it that we're going to discuss.
Yeah, very much so. And it's interesting that you talk about that, because when we visit different practices throughout the country, that's one of the top questions we get is, what posters am I actually supposed to have posted within the facility? What am I supposed to provide to our patients? So I'm so glad that we're going back over this. Now, as you talked about what it is, can you talk a little bit more about who it applies to? I know there's been a lot of confusion about this.
There has really been a lot of confusion about this, and I think initially the confusion was, especially for many healthcare providers, is that the rule applies to all program or any health service or program that receives federal financial assistance, or FFA. And federal financial assistance can be in many different forms, but the key part that I think healthcare providers saw was that it didn't apply to Part B payments. And so we saw a number of physician practices that were saying, well, it doesn't apply to us because I don't accept Medicaid and I'm a Part B provider, so it's not this, we don't have to worry about it. But that's not necessarily the case, because if you think about, it's not just Part B it's not just Medicaid funds, it's Medicaid funds, it is Medicare Advantage plan funds. So if you're a Part B provider and you accept Medicare Advantage funds, that also puts you in this category. And it also includes any grants or incentive money. So you think about, the meaningful use incentives that you may have received. Think about the MIPS program. So even though Part B isn't included in this, it is safe to say, and even in the government's comments, they even reiterated, yes, Part B is not included, but many providers are going to still fall under this. And so it's just a very prudent practice to make sure that you are in compliance.
I actually remember that comment well, where they talked about every covered entity or business at some form or another is receiving federal assistance to some way, shape, or form if they're a covered entity. It was a really interesting comment. Now,
Right.
as far as the notice of non-discrimination notices, are these a little bit different types of notices that should be posted? Let's say, we get questions regarding notice of privacy practices. What's the difference between this notice as well as that notice?
So the difference is, I think we've all been inundated with the notice of privacy practices that's required to be posted in a very prominent location in the practice, as well as the website. This notice is different. This notice is explaining that your practice is not going to discriminate. And same concept as the notice of privacy practices, you have to have it in a conspicuous physical location where you are interacting with the public. So for healthcare providers, that needs to be in your waiting room. It needs to be somewhere where it can be seen. Now, one thing that did change, and this is a big change that I think will make a lot of people happy, is you were initially required to print taglines in the top 15 languages that were spoken within your state, and include those taglines and your notice along with any significant communication or publication that you had to patients. So I'm sure everyone on this call has received an EOB that had 3 or 4 additional pages in it in multiple languages. That's this requirement. Now, from my experience in working with healthcare providers, I don't know how well this was being complied with initially. I'm not calling anybody out that's on the call, but I do know that I don't know how well this was being done in the first place. But the good news is you don't have to do it anymore if you were doing it. So if you were sending out with your billing statements, this notice of non-discrimination and your taglines, that is something that has gone away. You do still have to post that notice in a prominent location in your practice, and you still have to post those taglines in a prominent location in your practice. And if you don't have that in place right now, we can definitely help you with resources to determine what those top 15 languages are.
Hey, Loretta, before we move on to the next slide, can you also talk a little bit about the website requirements for posting? That's been a question we've answered several times as well.
That's a tricky one too, because there, you know, it is, you have to do that. That's part of the requirement, and you have to have that on the homepage of your website. And so you do have, and that might take a little bit with your website programmers to figure out how are we going to post these, you know, this tagline information on our website. But there is a great example that I'm happy to send. I didn't include it in today's presentation, but I could send it to anyone that's listed of the HHS website and how they've done it, because they, I mean, clearly if they're issuing the rules, then they need to be doing it as well. And they do have a good example of that. But yes, you have to put it in a conspicuous place on your website, which is technically the homepage.
Yeah, and I've seen a lot of clients who will post like a link that will launch out to the top 15 or their notice and those types of things. As long as I believe it's in a conspicuous spot, that seems to be the key.
Exactly, exactly. It shouldn't be hard to find, in other words.
Well, I think it's exciting news that we'll no longer need those significant publications to include the notice, and that's going to be a huge cost savings to not only practices, but the government and everybody across the board, which I do believe was one of the reasons they cited it, is the savings that would happen. So it's really exciting time right now with some of the, I guess, easement of some of these more stringent requirements that we've had in the past.
Exactly.
And as you've talked about some of these top 15 languages, can you explain these requirements a little bit more?
Sure. So to give you an idea of what I'm talking about with the tagline requirement is you are required to have this in the blue box on your screen. This is the statement that you need to have, and it needs to be translated into each of the top 15 languages that are spoken in your state. Or if you say you're in an area that you are seeing patients in multiple states, you have to make sure that you're addressing each state's at least top 15. The government has said if you want to do more, you can do more, but you have to have at least those top 15. So you do have to have this statement that says, attention, if you speak whatever language, language assistance services are available to you free of charge. And then you have to give them the number to call. And this is what I think a key part that gets missed. And I've seen this before where these taglines have been translated and they're posted, but no numbers are listed on the taglines. You need to make arrangements with interpreting services ahead of time. You've got to have those set up. You can't just wait for someone that speaks Spanish or that speaks Japanese to just show up and need an interpreter. You really have to have these relationships in place beforehand, because you've got to put those numbers for those individuals to call in order to even get your services. And in addition to that, from a HIPAA standpoint, and I know Chad's going to love this because we both love HIPAA, but you've got to get those business associate agreements in place with those services as well.
Sure. The taglines and acceptable language services has been a huge question. What is considered, acceptable language assistance? We've had numerous questions come in regarding this topic, whether it's a family member, whether it's an interpreter, and those types of things. What are some of these language assistance services that clients or anybody attending this call really need to be aware of?
So the first one and the easiest one obviously is the oral language assistance. And this is, I mean, exactly what you're seeing on the screen. It's an interpretation of non-English languages provided in person. Now, the key is it has to be provided by a qualified interpreter. And qualified within Section 1557, there is no specific criteria that is listed for qualified. So as an employer, you can determine if an employee in your practice is qualified, within quotation marks, so you can't see me doing that, but qualified to provide interpreting services. And this is a question we've gotten a lot too, is, you know, I have a bilingual biller. Can I use them in, you know, the clinical exam of an individual that speaks another language? Well, are they truly qualified? Do they have the clinical knowledge to be able to translate or interpret in a way that the patient is going to understand it? So I think that is a key thing to think about when you're trying to arrange for these types of services. I know of many clinics that are using employees in that capacity, but it may not be in the best interest of the patient or the practice, because if they're not able to interpret that clinical data in a way to get it to the patient in a way that they understand, there could be other liability issues. So you want to make sure that you do use a qualified interpreter. And there are a ton of resources out there available. If you can find somebody that you can have in your clinic, that's obviously great, but you need to consider the risks associated with that if they are not a clinical individual. The other type of translation can be written, and this again can be performed, again, qualified translator, so you can have it translated electronically and provide it to the patient in that manner. Now, Chad mentioned using family members or friends. So the rule specifically prohibits using a minor to translate. And I know that happens a lot in many practices where you've got a 12 or 13-year-old child that is coming in with mom or dad, and they are the one that speaks English, and so they are interpreting for their parent. This is prohibited by the rule unless it's an emergency circumstance. And for most of you, unless you're working in urgent care, emergent care, that's not going to be acceptable. So we have to let patients know ahead of time that that's not going to be acceptable and offer them a way to have another interpreter. The use of family or friends that are 18 or older, or whatever the age of majority is in your state, that is also a little tricky, because if you're using somebody that's a family member and you're giving incredibly bad news to that individual, are they going to disclose that information in the fullest capacity to that patient? And that's another risk that you have to consider. So if it's from a liability standpoint, it's probably best to use a third party. I get that that's not always the best thing to do from a financial standpoint or for this from the standpoint of the patient. But if you have a patient that insists on using a family member or friend and they're an adult, I would recommend having them sign some kind of consent, and we can help you guys develop that. I've got some language that we can look at for that, but just letting them know of the risks and them accepting that risk so that you at least have yourself covered on that end.
I totally agree, and I'm so glad you covered that, because we've got that opinion with these types of services that if it isn't documented, it didn't happen, as is the case with so many things in healthcare.
Everything in healthcare, I think. All right.
So now the auxiliary aids and services, what actually constitutes, say, a qualified sign language interpreter in these large print materials? Can you talk a little bit about what they exactly mean with these auxiliary aids and services?
Sure. And I think the key here too is, what's acceptable. And we've had this situation before too, where you maybe are providing large print materials, or maybe you're providing captioning or screen reading software, but the patient doesn't like it. And it's not that it's not working, but they just don't prefer it and they want to have a live face-to-face interpreter. Those are times when things can get a little bit tricky. But the rule actually says that these are and these aren't the only ones, but these are the main ones, but these are acceptable auxiliary aids and services. And so I think if you are providing acceptable aids and services, then if you have a patient that is adamant about not doing it, I would recommend if you're a client of us, call us and we need to talk through each scenario because every scenario can be different. But from the government standpoint, if you're providing something that's acceptable, you should be okay as long as you are able to get that patient what they need. Now, again, qualified sign language interpreters, again, we want to make sure that whoever you're using is qualified. Another thing I want to mention is, and this was a change in the final rule, the Section 1557 initially said that if you were going to use remote interpreting services, which are less expensive and they're just more convenient, but the original rule said you had to use video only. Well, they have backed off on that, and now they will allow audio interpreting services. Now, clearly that's not going to work for a patient that is hearing impaired, but in cases where you can do audio, if instead of video, that is now acceptable. So we definitely wanted to point that out.
And to that extent, and where we're talking about remote interpreting services, that's the case that we saw come out from Puerto Rico. In fact, was even today, we received this notification that OCR did a resolution agreement due to an entity in Puerto Rico for providing interpreting services for mental health hotlines. Now, mental health hotlines, some of those, they had to make the TTY available for those hotlines and provide counseling services through live chats to benefit those who are deaf or hard of hearing. Anything else that we need to talk about with regard to that resolution agreement?
Well, I think, that's a very good point. This was, it was issued today. This is hot off the press. And because they were failing to provide these services for individuals that were deaf or hard of hearing, that basically denied them equal access to the mental health services that they needed. And so I think it is, which kind of also brings me back to a point that I forgot to mention, is you have to be sure that you are providing access in a timely fashion, free of charge. And I have dealt with this probably, all my years in healthcare when it comes to these types of questions. The main thing that we hear is, I'm not getting reimbursed for this as a healthcare provider. It is costing me more to see this. It's costing me to see this patient. I'm not making any money off of it. And I get that and I sympathize with that, but you don't have a choice. You cannot pass this cost on to the patient, and you can't make it difficult. Not that any of you would, but you can't make it, we're only going to schedule these types of patients on one day a month because we want to get an interpreter here and utilize them the whole day. Now, if it works out and you can do that and it's not an urgent or emergent case, maybe, but you have to be very careful with that because you have to provide timely access. So I just want to remind everybody about that.
And I think it's going to keep getting interesting as we continue to hear more and more patients becoming more familiar with these laws, what services are available to them, and those types of things. I think we've seen an uptick in requests for language assistance, especially.
For sure, for sure.
So now, as far as things you need to do now, do you want to kind of summarize some of what you've talked about today for us?
Sure, and I think the main points, and I want to keep them brief, but to take away from today's webinar for you in your practice, what you can do right now when you get done, if you're in your office, you can go look, see if your notice is posted, see if you have a notice of non-discrimination posted, make sure that those taglines are posted as well. If you don't already have relationships with interpreters or translation services and other types of auxiliary aids, start that process and get those processes in place prior to needing them, because that's another key part of that timely access. If you already have the relationship in place, it should just be a phone call or an email that you can set up that interpreter. And then something that we didn't mention before, but a grievance procedure. So if you have 15 or more employees, you're required to have grievance procedures and designate a person responsible for grievances. Now, this is something that was slightly different. The final rule removed this from section 1557, but what it didn't do is you still have a requirement under section 504 of the Rehabilitation Act to have a grievance procedure and a designated employee. So even though I don't want anybody to be confused if they see some press bulletin that says you no longer have to have a grievance procedure under section 1557, that's true, but you've always had to have it under section 504 of the Rehabilitation Act. So if you don't have that in place, let us know. We can help you with that as well. And then finally, just if you have been one of those compliant practices out there that has been including those including those taglines and notices in your significant communications, that is something that you no longer have to do. So if you have, good for you, but now you can stop. So that's a little bit of good news. And I think with that bit of good information, I think I'll give it back over to Chad.
Well, and I just want to remind everyone that in our form section for our clients, we do have what section 1557 means for your practice. That document that does include some links into some resources that you can use for, say, developing a notice of non-discrimination, for creation of taglines and those types of things. So if you need help accessing that, please let us know. In the meantime, Nicole, have we had any questions come in?
Yes, we actually have quite a few for you guys.
Oh
so
boy.
The first one, does section 1557 apply to a health insurance who accepted PPE money?
Oh, good question. So it's a health plan, I'm assuming, well, hang on, let me read that question to me again, Nicole, please.
Sure. Does section 1557 apply to a health insurance who accepted PPE money?
You know what I wonder, and I'm not sure if they're talking about, say, do you think this is maybe a provider-sponsored health insurance plan? I'd be curious.
Well, I think it might be a couple of things. It either may be that we've accepted health insurance, or we've accepted a payment from a health insurance plan that accepted PPE money, or I'm wondering if, oh man, I think if that is the only thing that you think would make you qualified as covered under section 1557, then I would want to dig into that a little deeper. But my guess is if you are taking any Medicare Advantage money, if you are accepting Medicaid, if you've ever gotten meaningful use money, I think you're already obligated. So we might need to chat about this offline because I feel like I need some more information.
Yeah, and my gut would say yes, that it would apply, but I would definitely want to double check.
Right.
Okay. Your next one, do you have an example of the consent for family or friends to translate?
Yes, I have that. I don't know that it's in any of our forms yet, but it's very simple. But we can get that out, and I don't know how we want to, we've got contact information for these individuals, but it's basically just letting them know you are consenting, or basically that the practice is recommending that you utilize a qualified language interpreter. You are choosing to use a family member or friend. Please understand that we cannot guarantee that information will be interpreted in a manner that is sufficient. Something along those lines, but I've got that language and we can get it to you.
Okay. Can a practice use Google Translate?
Oh, I was hoping we wouldn't get this question. So
Sure. My understanding of this is the short answer is yes, they can, but it needs to be verified. Is that your understanding of it?
Well, here's the kicker on this, because we're going to roll over into HIPAA. So We're using Google Translate. If we're using the free version of Google Translate, is Google going to be willing to issue a business associate agreement? Because that data, that's protected health information. And so I think that is the key. Wouldn't you agree on that one, Chad?
I would agree. And other than the one consideration that we have right now is, let's say that it is somebody coming in for COVID-19. I think the enforcement discretion would roll over into that and
Correct.
perform. That would be my only question, but I would say whenever you can, if you're using Google and you have a business associate agreement, that would be the best thing to have. Let's say
Yes.
you're using there, is it Google for Business, I believe, that does the business associate agreement?
Yes. Yeah. G Suite, Google for Business. Yes. So it's, no one likes this answer, but you really need to read the terms of use for any app that you're using that involves protected health information.
Yeah.
I've read that one, but it's been a few years since I've read it. But I mean, I agree, Chad. I think it's a good tool, but you've got to make sure you're protected from a HIPAA standpoint.
And I would
Okay.
say too, and plus if you're going to use, let's say that you're just entering in a sentence to give to the patient and it doesn't include PHI, it's just a general diagnosis or something like that, and you're putting that into a separate record, that would be another way that you could possibly use it.
Exactly. Exactly. But it's something that you have to go through that thought process on before just starting to use it.
Okay, and then can you review the required 1557 poster details?
Oh, we have a sample,
We do.
I believe, available. I don't know those off the top of my head, but it's basically letting your patients know that you're not going to discriminate in any of the protected classes, whether it's a disability or any type of, you're not going to discriminate on the basis of age, sex, race, national origin. I feel like I'm drawing a blank. Chad, do you have more you're adding on that?
And that's pretty much it, you know, and then that you're not going to discriminate against anyone who needs language assistance,
Right.
and that you have aids available to them upon their request, and provide the information on how to contact and receive those. And that's part of having that tagline available as
Right.
well, especially for those with limited English proficiency.
So here it is. It's race, color, national origin, sex, age, and disability. And it basically describes that in that notice of non-discrimination, but we do have a sample that is available.
Perfect.
And as far as posting, I've seen some very creative ways that practices have posted as I've gone throughout the country. I've seen practices that do post them right within their lobbies. I've seen practices post them right as you enter the breezeway. You'll see all their notices posted there. And I've even seen clear binders at front desks that are posted, have the notices available, and even on the kiosks when you're checking in, those notices will be available to access that way in many practices. So there's many ways that you can come up with posting this notice.
Absolutely. And I do want to mention something now that we've talked, and I wish we had covered this more in depth in the presentation, but the basis of sex definition that was issued in section 1557, that has now changed.
I'm so glad you're covering this. This has been a question that we've received.
Yes, and I apologize for not putting that in the main content, but it is now, the section 1557 initially expanded the definition of the basis of sex, and that was challenged in court, and it's basically been removed. So what originally in section 1557 was, they counted discrimination based on sex being not only the individual sex, which is what the original rule says, but also pregnancy, termination of pregnancy, gender identity, and sex stereotypes. And those things have now been removed. We are back to the original rule that is just on the basis of sex being male or female. So this was a very controversial issue. We are continuing to get questions about this. So we will probably be issuing some more detailed information about this because it is pretty complicated. So I'm glad that came up.
And I would say too that, and this is just, and I'm going to just go ahead and offer an opinion here right now, is you can almost tell a difference in when different administrations are in. So for example, when section 1557 was first put in 2016, You had Andy Slavitt and some of those other folks who were involved in the healthcare system then, who were part under the Obama administration, who had a different idea and a different way of seeing things than, say, the current administration and Seema Verma and those folks who are involved, where they, and Roger Severino, for example, where they kind of want to reduce some of the requirements, the burdens for practices. That's been a constant theme since the end of 2016. We've seen a little bit of a shift.
Right, agreed. So that's probably a good topic for a podcast.
There we go.
Nicole, were there any
Great.
other questions?
Nope, you guys are caught up here.
All right. Well,
we would definitely like to thank everybody for attending today and joining us. If you do have any questions that come up after the fact, here are our email addresses. Mine is on the left. It's the easy one. It's chad@hcp.md. A lot of you may have that already. Loretta's lmaddox@hcp.md. Please, if you have any questions regarding section 1557, reach out to us. Contact support@hcp.md. We'd be glad to assist you with your efforts. Once again, thank you for attending, and we look forward to you joining our next webinar.
great. Take care.